Good day, everyone. I'm John, moderator for this webinar. On behalf of the organizer conference panel, I welcome everyone for today's webinar, Sexual Misconduct in the Professions, How Healthcare Professionals Get in Trouble or Don't. I would now like to introduce our presenter for today, Mark R. Bagelman. Mark R. Bagelman is an experienced attorney in administrative and professional licensure law, representing a wide variety of professional clients from licensed individual healthcare practitioners to licensed healthcare facilities and many others. Mark became interested in law when he graduated with both bachelor's and master's degrees in philosophy from Emory University in Atlanta. Mark has been a presenter for over 30 national and state organizations and private companies as Kentucky Bar Association, Kentucky Office of the Attorney General, National Attorneys General Training and Research Institute. I would now like to hand over the floor to the speaker. Over to you, Mark.
Hello, thank you, conference panel. Let's move forward, please. So, sexual misconduct in the professions, based upon the content of the program here, we want to be able effectively, at the end of all of this for our hour, to identify the differences between law and ethics and morals, and maybe in the case of sexual misconduct, the mythical defense of true love. Examine the basics of professional power dynamic between the healthcare professional and the patient. Provide examples of state laws governing the current doctor-patient relationship, and review examples of state laws governing applicable employer-employee and supervise or supervisee relationships. Common elements about these laws from a licensure perspective prohibiting sexual misconduct. That is, prohibitions on sexual contact without consent. That's harassment. That's sexual assault. And sexual harassment of the patient, anyone under the authority of the person, a student, supervisee, and very often sexual harassment of employees or coworkers. Again, this is from a licensure law. Sexual harassment and unwelcome sexual advances or quid pro quo of employees or coworkers may certainly violate state labor laws. There are also prohibitions on the same issues as one, but to include prohibitions on consensual sexual contact while the person is a patient. I say see lawyer rules because we lawyers in my jurisdiction only for the last a little more than a dozen years in my jurisdiction have had a rule of professional conduct. There's a good rule for you. Not a code of ethics, not a code of ethical conduct. We lawyers in my jurisdiction are bound by a rule of professional conduct modeled after the American Bar Association's rules of professional conduct that were incorporated into state law. You also have a third category of prohibitions on the same as 1 and 2 above, prohibition on consensual sexual contact even after the person is a patient, either forever or for a defined period of time, from when the discharge is a patient, the last appointment, or last professional service from the patient. Be aware that in these kind of cases, if there's a doctor-patient relationship, like a dentist-patient relationship, and you think you've discharged the patient or had the last appointment, you've asked them to get another dentist, or the last professional service has been rendered to the patient may not see it that way. And 6 months into what turns out to be a bad sexual relationship with the dentist, they'll complain about you, and you could say, this was my former patient. And the patient would say, I didn't think I was your former patient. We went out together and you still asked me how my teeth were. Those kind of things like that. You have to be aware that what the patient knows and thinks, as whether you are their doctor or their dentist, may not be what you think. Let's go about what are thoughts from the courts, especially about professions outside of mental health. From the case Green versus California Board of Dental Examiners, this would involve a hygienist or a dentist. The California law allows the licensing authority to discipline a dentist who engages in sexual acts with a patient only if it is substantially related to the qualifications, functions, or due to the occupation for which a license was issued. They had a qualifier. Upon judicial review, a California appellate court, this was not like the Washington law that said no how, no way. It qualified it only if the issue is substantially related to qualifications, functions, or duties of the occupation. So the state licensure board, the California Board of Dental Examiners, gets out there and hammers a dentist. They could get their filling done anywhere. Upon judicial review, a California appellate court applied the facts found by the state licensure board to the rule of law, saying there was substantial evidence, that's a term of art in judicial appeals of administrative actions, there was substantial evidence to support a finding that the dentist used his status, I guess it was a guy, and authority to win his patient's trust, take advantage of their insecurities, a dental patient, and induce them to participate in a sexual relationship. The court went on to say, quote, during the times he found the women most vulnerable, the dentist incorporated erotic and manipulative touching of intimate parts of their bodies into the treatment. He then violated the patient's trust and exceeded the scope of the consent for treatment by seducing them into a sexual relationship. Note, the dental treatment involved female patients who were diagnosed with TMJ and problems with their bite, for which the dentist performed craniosacral therapy in a dimly lit room with soft music playing, which led to the deliberate exploitation of the patient by the dentist. That sounds like wanting to cozy up with the lights down low in front of the fireplace with a glass of wine. Here it was craniosacral therapy in a dimly lit room with soft music playing. You could see what the dentist was trying to do next. I will say that I bit off more than I could chew in this webinar because one of the bullet points was to detail a state licensure board case revoking the license of a healthcare professional for a consensual sexual relationship with a current patient of record. That will be the subject of a future webinar that I will do. I will give you summary and tips for avoiding liability and risk. Every state licensure board enforces similar laws. If you hold a dual credential, there are some social workers who are also alcohol and drug counselors. You will be held to the standard of each board. One board may say alcohol and drug counselors can't have a sexual relationship for 2 years with the patient. Social workers may say 5 years. Well, you'll lose your license if you violate one or not the other. You will be held to that standard. You can't say, oh, I met this person as an alcohol and drug counseling patient. It's been 3 years. I'm in the clear. Wrong. Review your own practice act and be familiar with updates and new standards. Your profession reflects evolving standards, including sometimes the criminalization of sexual conduct in the doctor-patient relationship. Be aware of malpractice issues as sexual misconduct is excluded from coverage. That doesn't mean you won't have to pay. It means that you'll pay out of your own pocket. It is a very intentional act, and intentional wrongs are not covered by malpractice insurance. And insurance, by its very nature, excludes intentional tax. Thank you very much to everyone at national and international headquarters. This has been a really worthwhile use of our time to cover the broad landscape of sexual misconduct in the professions with a focus obviously on healthcare professions and some examples from mental health.
That does conclude the session for today. Thank you everyone for participating.